Hello and welcome to UK Fitness Hub. My name's Travistarrant, and in today's video we're going to be going through ankle sprains. We're going to be going through what an ankle sprain is, how to ensure a fast recovery after an ankle sprain, and some of the best exercises that you can do to speed up that recovery. Let's get into the video. Before we get into all the fun stuff, which is the exercises, it's really important that we understand some of the basic anatomy of the ankle so that when we're rehabilitating, we know exactly what we're doing and why we're doing it. So here's an anatomical version of the foot and ankle. You'll notice we've got two bones here at the front. So we've got your shin bone, which is known as your tibia, and we've got a bone just alongside it on the lateral side, which is your fibula. We've also got three bony landmarks worth knowing, which is the medial malleolus, the lateral malleolus, and the posterior malleolus as well. So posterior meaning behind, lateral meaning away from, and then medial meaning towards the midline. So that's how it's all named and deciphered. Now, when it comes to a ligament strain is something that could be a grade 1 tear, which is mild, grade 2 tear, which is there's been more trauma but it's not severe, grade 3 tear, which is most of the fibers have broken, and then a full rupture. So ligament strains go into grade 1, 2 and 3, and then we've got a full rupture, which is the whole ligament has come off the bone. A ligament is a soft tissue structure which attaches bone to bone. This is different from a tendon that attaches muscle to bone. When it comes to ligaments of the ankle, the most common reason for sprains is where somebody has done a difference in loading from what they're used to. So what I mean by this is, let's say for example someone goes out on a run and they do a 5k, and I say to them, okay, when was the last time you did that? And they say, oh, I haven't done a 5k for 3 or 4 years. Sometimes the ligaments are under stress doing that 5k. They can get really tight, then they can fatigue, and then they can break down as well. So that's one of the reasons why people get injuries, a sudden change in load where they've gone from doing nothing to loads of stuff. Then we've got traumatic events. So I'm going to take football, which is the most common that I see with ankle strains. Let's take, for example, the foot's here, it's planted. Someone's then come in from the side, that's inverted the foot, so these two bones here have gone this way, the foot's come underneath, it's created that to happen. All of the ligaments on the lateral side have either torn or they've ruptured. On the medial side, you've got the bone then going and compressing into the medial side of the foot. And then that's the most common injury that we see in sport. So a traumatic event where something has happened where the force coming into the ankle has superseded the amount of strength that the ligaments have. So that's one of the common severe injuries for the ankle. So how do we know about time frame? Well, a grade 1 tear, which is a mild tear, I'd typically be looking for somebody to be fully recovered in 4 weeks. For a grade 2 tear, bearing in mind a grade 2 tear completely varies from low grade 2 to high grade 2, we'd be looking at anywhere between 6 and 10 weeks. Grade 3, generally we're looking at 12 weeks, and then for a full rupture, it can be 16 weeks. And that's just a general guideline based on the rehabs that I've had, and these are fit individuals that have had these rehabs as well. Sometimes it's shorter, sometimes it's longer. Another reason for sprains is when somebody's walking. If, for example, they walk and there's a rock underneath their foot, there can be a very quick, sharp twist. We can get ankle sprains at the front and at the medial side. I would say 90% of the ankle sprains that I see, however, are on the lateral side. Okay, so let's now move on to, you've had an ankle sprain, there's been an acute injury. Let's take the football example where somebody's tackled from the side and you know that something's not quite right at the ankle. You're starting to get inflammation and swelling. Now, the first thing I would want you to do before you do anything is stop the activity that you're doing. So you wouldn't believe the amount of football players, rugby players, netball, basketball that I see where if they would have stopped immediately after feeling the sensation of injury, they would have probably come away with a grade 1, maybe a low grade 2 tear. But those that keep going, no, I'll be all right, they end up making the injury substantially worse, getting secondary injuries, and that completely ruins their initial rehab. What could have been 4 to 6 weeks is now 10 weeks, for example. So once that's happened and you've stopped the actual exercise, you're resting now, you're elevating the leg hopefully, start to put cold on it straight away. No more than 10 minutes. And the whole reason is that there's so much trauma and soft tissue damage that will be going on. The ankle's going to start the inflammatory process. And that's a good thing because we do need that inflammatory process because it's the start of healing. But one, you're probably going to be in pain, and we can manage pain through ice. And also as well, we can help stop the secondary bleeding that's going to occur through the actual trauma. So the bleeding underneath the skin is essentially going to, one, be problematic in terms of if it's too much, we can get some real big swelling. And also as well, it's going to make the injury potentially affect tissue around the injury site, which then may become injured as well. So we might, for example, have the injury site here, there's loads of blood, seeps into a bigger area, and then all of a sudden we've got a secondary injury because the healthy tissue around the injured site is now also the injured site. So cold is going to constrict the blood vessels, going to stop bleeding, or at least slow it down. Once 10 minutes is gone, the opposite's going to happen because you're going to start to get a frozen blister burn. The body is then going to put blood back into the area because it's going to essentially assume frostbite. So what we need to do is put it on for 10 minutes, constrict the blood vessels, take it off. It's not going to do any more for the body. It's only going to do more damage if you keep it on for more than 10 minutes. Now, when should you go to A&E? So let's say, for example, the ankle swells up massively, and we're talking really, really swells up. That for me may be an indication that there's more than just soft tissue damage. So that's when I would send someone to A&E. Another reason I would send someone to A&E is if I pop my fingers just on the sides here, so on the tibia and the fibula, and if I started to squeeze in and they was getting horrific pain, that again might be capsular damage, potentially a fracture or break of the bone, because I'm not underneath the malleolus, I'm on top. So I'm not here where I'm squeezing into ligaments and they go, oh, that hurts. Because I'm on the bony prominences up where we are above the medial and lateral malleolus, that's going to be an indication that we shouldn't really be getting sharp, intense pain there, and it could potentially be a fracture or a break. So we definitely want to send someone to A&E. And then the third individual would be somebody that has seen me 3 days after maybe the acute injury. They're on crutches, they cannot walk at all. I mean, we're not just talking they put their foot on the ground, they get pain. They put their foot on the ground and the whole ankle buckles. They've got no strength whatsoever. Again, that might be a sign of capsular damage, deeper damage. For those that have sprained the ankle, sometimes there's additional damage such as pulled muscles, pulled tendons. Sometimes there's bruising of the actual bone. So those injuries can take longer as well. I'm sure you've all heard of the acronym RICE, so rest, ice, compression, elevation, and that couldn't be more true with ankle sprains. So we want to rest the foot for especially the first 3 days. We want to ice it initially in the very, very first phases of injury. We want to compress, but not compress to the point where you can't move the foot. You should be able to move the foot if you compress it. And that's basically, people like to compress for the first kind of 2 to 3 days just to make sure that they don't go over again on the ankle more than anything. And then we can elevate as well, the foot above the heart to aid that inflammatory process, get the lymphatic drainage going better towards the heart as well. So those are the initial phases. What happens now is we then start to, at day 3, get the ankle moving again. So unless they've put you in a soft boot or something like that at A&E, what we want to do is we actually want to start moving and mobilizing the joint. So there's nothing wrong with doing absolutely nothing and completely mobilizing it for the first kind of 2 to 3 days, but really at day 3, we want to start getting it moving. So what that's going to do is it's going to start actually working the ankle back and forth, And what we can do is we could start to get some fresh blood flow and nutrients into the joint. We can start to get the joint working again and start that initial rehab. So let's say, for example, again, let's take that football example. Somebody has strained the lateral ligaments. Maybe they've got some tendon damage as well. For me to work the ankle as safely as possible, I'm only going to do the ranges of motion that I can do. So if I go, let's say, into inversion where the foot goes this way, or eversion where the foot goes the opposite way outwards, and that is excruciatingly painful and you can't move it at all, that's fine. We don't work that. We might go into plantar, which is these toes and foot pointing down, and dorsiflexion the opposite. And if you find that that's pain-free, at least then we get the capsule, we get the joint working and moving and dispersing some of that scar tissue that's going to be forming at the side of the ankle. So that's the initial phase. We want to just get it moving. And I'm going to go into first the range of motion exercises that we can do. And then I'm going to go into the strength exercises. But it's really important when you have got that initial injury to make sure that you are only going into safe ranges of motion. You're not pushing into loads of pain. The last thing I wanted to cover is ibuprofen and anti-inflammatories. So anti-inflammatories I wouldn't take if possible unless the pain is unbearable. So you might think, hang on a minute, that's a massive contradiction because you said to put ice on it and that's an anti-inflammatory, so why can't I do anti-inflammatory drugs? So ice at the initial stage of injury is more important than anti-inflammatories because ultimately what we want to do is we want to put on the ice, have 10 minutes and then take it off. Stop the bleeding or stop secondary injury. But after we've taken the ice off, realistically, we don't need to put it back on. If you take an ibuprofen or an anti-inflammatory, what's going to happen is that's going to stay in the system for about 6 to 8 hours. So it'd be like putting, hypothetically, that ice on for 6 to 8 hours. Plus as well, it's going to affect other parts of the body as well, not just the one site of your pain, which is the ankle. So realistically, if you can, try not to. It disrupts the healing process quite significantly in terms of the speed of initial acute injury. So try not to, but if you are in excruciating pain, absolutely, as long as you can obviously take anti-inflammatories. Let's get onto the range of motion exercises and let's then get onto the strength exercises. So when we train up the ankle specifically during range of motion, what we want to do is work the 4 ranges and 4 positions of where the ankle goes. So into dorsiflexion, which is bringing the toes and foot towards my body. Plantar flexion, which is bringing the toes and foot away. Inversion, which is bringing it to the left-hand side, so towards the body. And eversion to my right-hand side or away from my body. And of course, for the opposite, for inversion, I'll be bringing my foot to the right and eversion to the left for my left side. So what you'll be looking to do is work within the range of motion that you can do. So again, if we've got an injury, and let's say, for example, you went, that's as far as I can go on inversion, just work within that range of motion. What you probably notice is as well, as you start to work in the pain-free range, what will happen is over time you'll be able to get a little bit more and a little bit more and a little bit more. You're trying to compare both your feet as well. So let's say, for example, you go, cool, my dorsiflexion's really bad. Always check with the other foot because sometimes both feet are bad, right? So just make sure that you're trying to get even on both sides and you're trying to use your good leg and your good ankle as basically the pinpoint of how far you've got to go on your bad one. Now, once you've done that, doing repetitions of forwards and back and side to side can be really, really boring. So if you're just going to do, let's say, 15 reps one way, 15 reps the other, 15 and 15, in pain-free ranges of motion, of course, it can bore people to tears. So this is where a small ball comes in. So you'll notice I've actually deflated this a little bit, so it's got a little bit of give. What I can do is actually start to work the foot back and forth. So as I come back, I'm coming into dorsiflexion. As I come forward, I'm into plantar flexion. So I'm actually doing that movement but over the ball. I can also do inversion and eversion. So I can roll one way, roll the other, roll one way, roll the other. So it's another option if you want to get something a little bit more engaging. You can also, when you start to get the full range of motion, so let's say, for example, you can plantar flex and dorsiflex absolutely fine with no pain, you can start to get resistance bands. So I could pop this resistance band, start to pull it towards my body, and now when I plantar flex, it's going to be a lot harder. Exactly the same for dorsiflexion. I can go the other way, I can tie this on, and I can come back. So I can tie it against, let's say, a wall or a fixed bracket. You could do the same for eversion and inversion. So for inversion, I could use a band like so, or for eversion, I could pop the band on both feet and start to come out. Make sure that when you do things like eversion, that you're not doing this with the hips, keep the hips nice and stable, and you're trying to just work that ankle complex. Again, what I would do with things like plantar flexion, dorsiflexion, is you might want to get someone to hold it for you. You might want to tie it around something so you can focus just on the movement without you having to physically get the bands into position. Now, one of the things that we see quite often is that people rehab and then they go straight back into injury. So what happens is they do their rehab, either maybe little rehab, but the soft tissues have recovered, and then they end up going for another run or a football game and get injured straight away. And that's generally because we've still got functional instability. So whenever you do something, let's say you close your eyes and you touch your nose, you've got those receptors that tell your body what to do. And sometimes you'll notice after an ankle injury, where you might be walking along, you might just feel a bit of laxity in the ankle still. It might not feel strong. That's where your stability exercises come in and your active range of motion exercises. So how we can progress these up is we can start to do a couple of exercises and we'll go into those next. So we're going to start to up the ante on the plantar flexion and dorsiflexion exercises. So what I want you to do, and we're going to be working plantar flexion on this one, is we're going to get a step. This can be, for example, your stairs. It can be anything basically where you've got a flat lip, and then something you can put your hands on as well, because we don't want to be worrying about stability in this exercise. We just want to be going through that active range of motion. So the step's really good because as I step on the step, I can come down into a position that I wouldn't be able to get into if I was on the floor, because I'm coming below what is natural. And then I'm coming up, big squeeze of the calf at the top, coming down and coming up. Now again, you could do this for 15 repetitions. You're working through the same range that you was doing before, but this time we've got some load. Once you get comfortable with that, you could go just onto your bad side and start to come up and down. If that's too much, you might decide just to start off on the step without coming too far with the heel. But again, you can choose to do those. Choose the one that you find most appropriate and get better and stronger at plantar flexion. Now, if we get rid of this, dorsiflexion, we can bring the knee in and back. And this would be the start exercise we would do just to get a little bit of load through the ankle joint. So as I'm coming forwards, I'm keeping my body completely still. I'm not leaning into the motion, putting extra pressure on my knee. If this is all good for you and you don't feel any fatigue and you can do this for 15 reps of 2 sets and you feel absolutely fine, how we can then make it harder is in a standing position. I've got a split stance here. Again, I'm going to keep myself back. I can start to then load through more dorsiflexion because now I've got more load, because I've got more body weight going through. So those are some good ones to get started with. Let's go into the next set. So what I want you to do for the last couple of exercises is proprioception exercises. So this is essentially where we're working the ankle stability. Now, for a lot of people with a poor ankle stability after rehab, these are the types of exercises that we would do just to get that stability. Remember, with good stability, when you go on walks or when you have to quickly adapt to certain stresses, your ankle is going to have a lot more proprioception and a lot more ability to be able to resist force than it would if you had poor stability. So very simply, you would just stand on one leg. And if you can do this, you might notice the ankle wobbling. For a lot of people, I start them off on their good side, just so they know what that feels like. And then they come onto the bad side, and then they can then see immediately the difference. You'd be looking to work up to 1 minute. Now, if you could do 1 minute and it felt fine, the next thing I'd get you to do is exactly the same, but this time you close your eyes. So you don't have a point that you can look at any feedback. What we're also looking at is, I'd be looking at the actual ankle joint. Are they collapsing the arch? Is the knee coming in? We want to keep everything nice and structurally correct. So we'd be in this position as opposed to collapsing the arch like so. And then finally, if they can do all that, then we start to come into this position. We start to get them to open the hips and start to increase more range of motion through the exercise. If they can do all that, the last stage would be return back to sport if they got this through a sporting injury. So for example, a basketball player, we might get them doing very simple hops on the ankle. We might start to get them jumping and accelerating and decelerating. With a football player, I might put out some cones and I might start jogging one side to the next and getting them to accelerate and decelerate really fast. But ultimately, it's exercises specific for the sport that we'll be looking to integrate at that point, and additional loading and getting them back into whatever the sport that they was doing. So trying to replicate what they need. For a boxer, lots of split stance movements. But yeah, so hopefully that covers all of your ankle rehab needs. You've been watching UK Fitness Hub today, and I've been Travistarrant. If you have any questions at all, please do not hesitate and put them in the comments box. I look forward to seeing you soon in the next video.